Today, we're going to talk about joint health for runners. This is a really common question I get, especially related to knees. And there's a big myth of running being really bad for your knees. So we're going to go over that and just general joint health for athletes, for runners, and why that's actually not true and why it's a myth. So research actually indicates that recreational running does not increase the risk of knee osteoarthritis, which is the most common type of arthritis. When runners say they have arthritis in their knees, it's typically this osteoarthritis, which is just this arthritis of the bone, and may even have protective benefits. And we'll go over some of this. So running is one of the most popular forms of exercise worldwide. I think we know this. We're a very special population, especially those that are taking camp. But many people fear, and this is runners and non-runners, that running is quote unquote bad for your knees. You'll hear even doctors say this. I've had so many people come into my office that have said this, or just people you come across in life when you try to explain that you're a runner, that, oh, you know, your knees are going to be torn up when you get older. It's so bad for your knees. I'm sure you guys have all heard this. But the reality is that research shows that recreational running is associated with actually lower rates of knee arthritis compared to sedentary people. Now, of course, there's a bell curve, as with most things, that if you are very inconsistent, and we'll go over kind of what could increase your risk for arthritis. If you're very inconsistent, if you have low mileage, and this would definitely be like the sedentary population over here, that's not going to be great for your knees or your general health. Then you're going to come up this, most people are going to fall in the middle, in this recreational runner category, that you actually have a lower rate and risk of arthritis in your knees compared to that sedentary population. But then we get over to the other side, and if we were to look at elite marathoners that are doing upwards of 120, 140 miles a week, that's also not going to be great for your joints and will likely lead to an increased risk of arthritis. Not saying it's going to happen, but that increased risk of arthritis as that population gets older. So it's definitely a bell curve, but for most of us, we're somewhere there in the middle, where research is continuing to come out that arthritis is actually lower compared to the sedentary population. But it's all about smart training, strength, recovery, a lot of the same variables that we have gone over as it relates to performance and doing well in running and staying injury-free, being consistent, will also apply to joint health. So here's that myth: running is bad for your knees. No increased risk of osteoarthritis. There's been tons of studies. There's been one big one, a large long-term study out of Stanford. Oops, where'd my slides go? Out of Stanford, that there was no link between running and a higher rate of arthritis in your knees. And there's been some research, not quite as large as the Stanford research that came out, and that research study suggests that running can have a protective effect on joints, especially if we're strengthening all of the muscles around the knee. So we're looking above the knee, below the knee. We're looking at your hip, all the muscles that come down and insert around your knee. So hamstrings, we have quads, we have those lateral hip muscles, we have muscles on the inside of our knee and hip, those adductors, those adductors, those ones that bring your legs together that help protect your knee. And then also looking below, so you have your calf muscles that come up, your shins come up. We have muscles on both sides of our shin there that come up and help to support the knee also. So that really helps. And we'll go over, more about the joint itself here as it relates to the synovial fluid that's mentioned in that last point. And then, like I mentioned, there is actually protective benefit of improved joint health. So the general consensus is that recreational running improves joint health due to that motion is lotion effect, that moving is essentially WD-40 for your joints, that the more we move them, the better and healthier they are, as opposed to sitting around all day. So I just want to go over a little bit of joint basics, and this is where that synovial joint will come in. That a joint is where two bones meet. They're supported by cartilage, and we talk about this most in the knees as runners. Unfortunately, there's a pretty high rate of like meniscus tears. People need meniscus debridement surgery where they go in there and clean it up. And so that meniscus is a cartilage that sits in between your two joints of your knee to help cushion it. You have ligaments that connect bone to bone. So all the ligaments, your ACL is the most popular one, unfortunately, because so many people rupture it. in your knee that help provide stability, but we have many ligaments inside our knee and on both sides of our knee that help support it, connecting your shins up to your thigh bone. And then tendons, which connect muscle to bone. So there we have like our quad tendon that comes in, our patella tendon at the front of our knee. All of those muscles that I mentioned that are around your knee connect to the bone via tendon. And then we have synovial fluid, which is just this fluid inside the joint that provides that lubrication. So it helps to nourish the cartilage. So make sure the cartilage is healthy. We don't want that cartilage drying out or getting too dehydrated. And it prevents that wear while the joint's in motion. So we get more of that fluid in, more of that synovial fluid as we're moving, in this sense with the knee, as we're bending and straightening the knee, as we're weight bearing. That's when we get more of that synovial fluid in the joint, which helps protect the cartilage in there, your meniscus in there, and the joint itself. This is why a lot of times after you sleep, when you get up in the morning, you feel a bit more stiff. If you've been sitting in the car, if you've been sitting on a plane traveling, we feel a bit more stiff because those joints aren't moving at all. And so we're not getting the fluid in there. The muscles around them tend to be pretty tight too after we haven't been moving. So that's another factor. But the more we move, the more fluid, that synovial fluid we get into the joint, and then the better it's going to move. This is a general recommendation. It also applies to joints, but this is even like the CDC recommends for general health, that 150 minutes a week of moderate to vigorous exercise. I think most of you guys are getting that, but just wanted to throw that recommendation in there. So we've gone over this a little bit, but key joints to running, we have our hip, big stabilizer, big power generator. So you think if your glutes attached around your hip, that's a big one. Your quads attached more at the front of the hip, another big power muscle group. And it really helps to stabilize. We've gone over this in past presentations, but if we have weakness even on the lateral side of our hip, we get that knee collapsing in. If you watch someone behind them, so you guys have seen where like their hips are going back and forth. So if the muscles around your hip aren't super strong, then we lack that stability and we get a lot of movement in our hips. Our knee, shock absorption and a force helps to transfer force. So the knee is a very basic joint. It just bends. It doesn't do any kind of rotation. It doesn't do anything out to the side, at least not with a lot of movement. There's a little bit of rotation, but we don't need to get into it. So that's going to absorb the shock as we're taking every step, as we're walking, as we're running, and it's helping us move forward. So a lot of those muscles that we talked about up at the hip are going to go down and attach at the knee. And then, of course, we have our foot and ankle down at the bottom, where our calf is having to absorb and dissipate anywhere from 8 to 10 times our body weight as we run, depending on how fast we're moving, the surface we're on, etc. And so the big takeaway from this is joints aren't passive. They're very much active. So they adapt by being loaded, and they get stronger by being loaded and trained appropriately. So just like muscles, and we've talked about in general run training, we want to load our joints to make them stronger, all the muscles and tendons around them. And we want to train smart and train appropriately, that we're not increasing our mileage too quickly. We're not going from trails or a soft surface to hard surface, too quickly. We're not changing shoes. So the general training principles we've talked about before apply to joints as well. So the impact of running on joints, running doesn't wear down healthy joints. I've kind of beaten a dead horse with this already, even a few minutes into us talking about it. But that high impact activities do stimulate cartilage turnover and increase bone density. So that cartilage turnover just means that you're making more of that cartilage. So we want that to happen. So things like swimming can be great for unloading your joint and can be great for general cardio vascular benefits. But if you're not getting the weight bearing nature that running gives us, you're not going to get those adaptations to your joints and in your cartilage throughout your body, but specifically your hips, knees, and ankles. We've gone over this, no higher risk of arthritis. And the problem isn't with running itself, but training errors. And so this is why I think this is still such a big topic of conversation and such a big myth, is that you see runners that are having to have meniscus surgeries, or they're having achy knees, or having problems with their knees. And a lot of times we can look back at their training and see that it was actually a training error. So we were increasing overall volume too quickly. We increased intensity too quickly. Again, the surfaces we're running, on the track every day of the week with it turning in the same direction. And that's why when we, especially when we warm up, we run opposite direction on the track to try to kind of unwind. But it tends to be those training errors, not running, that cause some pain in the knee or joint pain. So again, we got the training errors. Another thing that can lead to joint injury or any kind of achiness, pain at your joints, are muscle imbalances and weaknesses. So this is why we started adding in the last couple camps strength in your final surge. That every week there's a strength workout in there, whether you signed up to come in and do strength in here or not, just to help target those muscle imbalances as they are specific to runners. So weak hips or glutes causing that knee to collapse. We want to make sure those are super strong. Weak calves can cause an ankle issue, it can cause plantar heel pain, etc. And again, even weakness at your foot or ankle, if you have that collapsing in at your arch, you have that falling in, can cause your knee to fall in also. And then we're putting pressure on different spots of the knee that it's not made for. Another just risk factor is just general strength, and then also those muscle imbalances. And then biomechanics. If you have a history of recurrent knee pain, recurrent joint pain, that's something we can talk about, is that increasing your cadence can sometimes help. But I wouldn't go and change your cadence tomorrow where you go out and run and go, oh, I need to increase my cadence to decrease my risk of my knee hurting or decrease my risk of injury. Don't go play around with your run form tomorrow. But if you have a history of recurrent issues, that's something we can definitely talk about. And then there's these external factors. We have worn out shoes that can cause more forces to have to go travel through your body. So that's going to put more pressure on your joints if you're not having, and also if you're on, like we are unfortunately around here, on asphalt, on concrete all the time, those forces that are traveling through your body, through your joints, are going to be higher than if you're running on soft surface. You do want to be cautious though, if it's a soft surface, when I think of around here, like the beach, if it's uneven at all, unsteady at all, if you're going out on the trails, that can increase the forces and pressure we're putting on our joint if we're having to pivot a lot, which isn't necessarily a bad thing. You just don't want to go from running on the road all the time, running straight all the time, to trails every single run or the beach every single run, because it is so uneven. But just something to keep in mind, that if you are worried about your knees or have a history of having knee pain or joint aches from like the hips down, soft surface can help a lot. And even like a treadmill is a softer surface than running outside. So something to think about. And then previous injuries do increase that reoccurrence rate. Strategies to protect the joints. A lot of these we've talked about a little bit in terms of, we said that the imbalances of strength or weakness, how we're going to target that is going to be through strength training. So targeting all of those different joints, hips, knees, ankles, core. You guys know a lot of those exercises that we've put in Final Surge and that we've done over time. So strength training is going to help protect your joints. I always use the example more for our core, that we see the guys at the gym that have the weight belt on that are helping to protect your spine. We have muscles that can do that, so that the bony anatomy of our spine, of our hips, of our knees aren't having to take up the force of every step that we're taking when we're running. So we want those muscles, tendons, ligaments all around those joints to do the work, as opposed to that bony anatomy where we're going to get that decreased joint space. We're going to get more of that pounding, and that's essentially squishing of the meniscus. Mobility, flexibility, you guys have probably seen that I'm not huge on. It's not that I don't think there's value to it. I just don't think everybody needs it. We don't need a large range of motion to be able to successfully run. But if you feel like you have tight areas, you feel like you're lacking mobility in certain joints or certain areas, then absolutely this is something that we want to work on and make sure that you don't feel super tight, and that when we go to run, you're not able to get through the range of motion that's needed. Warming up and cooling down is a big one. It helps prepare the tissue to get ready to move. It helps improve circulation. It's going to reduce stiffness, improve blood flow. And then even the cool down, instead of having your heart rate go super high to super low, it gradually brings that down, gradually helps flush out all of the different toxins and waste that have accumulated in the bloodstream as we've done, especially a hard workout. So make sure that you're warming up and cooling down. Also, your joints will thank you. And then training progression, we talked about how that 10% rule, there's no research that really supports it, so we don't have to really stick to it, but we want to, it's a very good just rule of thumb, that we want to pay attention to not increase our mileage too quickly week after week, or our long run too quickly. And then good nutrition. I'm not a dietitian, so I'm not going to dive into that too much, but I think all of us know that good nutrition kind of helps everything, but it does also help your joints. This was one when I was doing research for this that was kept coming up over and over, and I think it's really applicable that there are so many supplements out there, like glucosamine and chondroitin is one of the big ones for joint health. And there are some people that have really, really good results with them, and there's some people that don't feel like it does anything. And so the research is really mixed over whether this supplement, or there's tons of different joint health supplements out there, of whether they help or not. Again, I'm not a dietitian that's going to recommend these or not recommend these. I would just say do your research with these, and be careful, because a lot of them aren't well studied and they're not really tightly regulated by the federal government. If you do decide to take these, please discuss it with your primary care physician, or your dietitian, and then also look for a certification seal from a trusted third-party organization. Like NSF International is a big one, but make sure that you're looking for that seal and that it is third-party approved, to make sure that what you're ingesting is actually what it says is in the bottle, since it isn't really well regulated. And red flags and when to seek help as it relates to joint health. So soreness versus pain. So muscle soreness is super normal. I'm sure all of you guys have experienced that. If you haven't done lunges in a while and you go to do lunges, if you haven't been running and you join run camp in 2 weeks and you're like, oh, like my legs are just so sore, that's okay. If you've added in a new activity, if you've added in strength, if you've added in intensity and you're sore for a couple of days after and then it goes away, that's totally fine. But pain that like just doesn't feel right, or that in your gut isn't right, and it hurts, it doesn't just ache, joint swelling, sharp pain, any type of instability, that's not normal, and that's when you would want to get in with either your primary care physician, PT, ortho, anything like that, just to make sure you're getting checked out, that if there aren't these red flags, that we want to get it imaged, and we're going to do further damage by continuing to run. So a couple of those warning signs would be swelling that doesn't resolve. So if you go out and run and your knee gets worse as you run and it hurts afterwards, it doesn't calm down, and then the swelling doesn't resolve, that's something that we would want to look into. If there's any kind of locking or catching at your joints, in the knee, a lot of times this relates to the meniscus. You'll feel like this locking or catching with bending or straightening your knee, or you feel like it gets stuck in one certain position. That's not normal. We want to get it looked at. Pain that gets worse with rest, especially if you're looking at days after running. So if it hurts a little bit right after you run or a day or two, might be normal if it's more of that ache soreness. But if it continues to get worse even when you're resting, that's not normal. We want to get it looked at. And then if it gets worse as we run, a lot of times it's muscle soreness should warm up as we run, but anything more than that, we want to make sure that we're getting it looked at, and really make sure you're not ignoring these symptoms. If we can catch things early, your downtime will be much shorter, and the potential to do damage to that joint will be much less. So just overall, some practical takeaways. We want to make sure that we're doing strength training to support those joints. We want to make sure that we're paying attention to those training principles, that we're not increasing too quickly, increasing too much, going too hard too often. With your shoes, make sure you're replacing them every 300 to 500 miles, depending on the shoe. If you have questions about shoes, one of the first ones we did this camp related to shoes. So go back and watch that presentation. I can send you the link if you don't have it. And then also just changing our mindset that running builds your joints, it doesn't break them down. So not being scared to run, not having that mindset of being fearful. That running is really good for your joints. We just need to listen to our body. And then do we have any questions as it relates to joint health or run camp in general? Anything that I can help with? All right, I'll hang on for another minute or two if anybody thinks of any questions. Otherwise, I will see everyone at Costco this Sunday, 6 a.m. for the fall training camp and 6:10 for Run Like a Girl. I hope you guys have a great day. And like I said, I'll hang on for a couple minutes if anybody thinks of any questions.
Hey, Caitlin, did you have any